Good morning, Mrs. Murphy. How are you? My name is Beth. I'm your nurse today. So I've just come in to visit you. The doctor has requested that you have an ECG, so a little scan of your heart before you have your procedure this afternoon. Have you had an ECG before? So the reason I ask you this is that some people are allergic to the adhesive dots, but you've had one before, no issues? Excellent. So what I might do first is I'll just confirm your name and date of birth, and then I'll explain to you what the procedure is going to involve. So, Mrs. Murphy, just going to have a little look at your wristband. And can you tell me out loud your name and date of birth? Excellent, that all matches. And any allergies? Lovely. So the ECG, Mrs. Murphy, involves me exposing your chest, but I do have a towel to cover you up. I'm going to place some stickers around the outside of your heart, mostly on the left-hand side, which is where your heart is. And then I'm going to pop the stickers on your wrists and on the inside of your ankles as well. Okay, so I've just got a towel for you as well. I'm just going to pop this core bell out of the way. So I do need to lay you down flat for this, Mrs. Murphy. Is that all right? Excellent. Okay. You let me know if you're uncomfortable at any stage, but I'll try and keep you warm and covered. Just laying your head back and bringing you up to my height. So just laying you flat. Lovely. Okay, just going to borrow your arms. And so I'm going to lift up your gown. Sorry, pull down your gown. Just keep you nice and covered. There we go. Thank you. Right. So these are the sticky dots I'm going to be using, Mrs. Murphy. All right, so first of all, I'm going to just expose your chest, keep you as covered as possible. I just need to feel in between your ribs. So I'm going to feel 1, 2, 3, 4. So your fourth intercostal space on your right sternal border. I'm going to do the same on this side. 1, 2, 3, 4. That's your fourth intercostal space on the left sternal border. Then I'm going to skip V3 and go straight to V4, which goes 1, 2, 3, 4, 5, but in the mid-clavicular line. You have got a breast, so I'm not going to pop the sticker over your breast. That can give artifact or movement in your reading. This will make it clearer. So that's V4. So 1, 2, 4, 3 goes in the middle. V5 goes in the fifth intercostal space on the anterior axillary border. So that is a fancy word for saying the front of your armpit line. So it should be lateral, it should be in a line with V4. V6 goes in your fifth intercostal space, mid-axillary line. There we go, just cover you up there. And then may I borrow your right arm? Thank you, Mrs. Murphy. So that's just going on the inside of your right arm, avoiding any bony prominences, pretty much just avoiding your bony bits. And I'm going to do the same on your left side. So internal wrist, avoiding any bony prominences. Keep you nice and covered. I'm just going to come down and do the same on your ankles. Won't be for too long, we'll try and keep you nice and warm. So right internal leg, avoiding bone, and left internal leg, avoiding bone as well. Excellent. Almost there, Mrs. Murphy. Okay. So this is the hard bit, just because it's always tangled. Give it a bit of an untangle. There we go. Almost done. So I'll attach these and then I'll do a printout. Go. So this one is for your right arm. This one is for your left arm. These ones go in your chest. So sorry, I'm just going to expose you a little bit again. So should be a little bit of pressure. 1 and 2 and 3 4 5 and 6. And now I just have to do your legs. Okay, so cover you back up again. Keep nice and covered. Just for this part, Mrs. Murphy, I have to get to lay very, very still, and I'll just get a reading on my screen. Always takes long when you're being watched. So if you're interested, Mrs. Murphy, you can see the reading. This is picking up the electrical signals of your heart. So when I get a nice flat reading, I'm going to press print, and it will print out an image, and I will label that and show it to the doctor. So I'm pressing print now. Okay, so now that that's printed, that's looking good, Mrs. Murphy. I'm just going to take that to label it. So, Mrs. Murphy, could you please confirm with me your full name and date of birth again? Excellent, I just wanted to make sure that matched while I label. So I'm going to stick that on there, and I'm going to write my name, the date, the time, the indication or the reason for you having your ECG was pre-op. Beautiful, so that documentation's all ready. I can go and show that one to the doctor. I'll just unstick you for the minute. I will give this a clean before I replace it. But let me take all of those stickers off your chest first. So these just peel. Shouldn't hurt, but just a little bit of a stickiness. Here we go. Bring this back up. And I'll help you get dressed again, Mrs. Murphy. There we go. Let me sit you back up again. There we go. Thank you very much. Give you a call buzzer. And do you have any questions? Looks pretty good. All right, there's your call buzzer if you need me. Thank you very much.